Good afternoon, everyone. I am Dr. Ameteshwar Singh from JK Medicity, Jammu, and today we'll be discussing on pedal edema and CKD, its causes, symptoms, and treatment. So, as we know, it is quite an important topic, and it is encountered in day-to-day practice. We'll explore what pedal edema is, its causes, and how it relates to CKD, and the best ways to manage it. So first of all, let's talk about pedal edema. Now, pedal edema is a condition where extra fluid accumulates in the lower legs and feet, causing them to swell. This swelling can happen for a variety of reasons like heart problems, liver problems, thyroid issues, kidney problems, or blood clots. Mainly, our body fluids are divided into two main areas. One is intracellular fluids, and other is the extracellular fluid. The outside area includes the space around our cells and inside our blood vessels. Edema or swelling occurs when the fluid accumulates in the extracellular space, that is, between the cells. Now, this problem can happen if there is too much pressure built up within the blood vessels, which is often because of heart issues like hypertension or because of congestive heart failure, or it can happen because of excess fluid intake, whether it is oral intake or IV fluids. It can also happen if there is hypoproteinemia, that is, if there are less proteins in the blood, because proteins tend to retain fluid within the blood vessels. So this helps in keeping fluid within the vessels. Additionally, if there is any obstruction or any poor functioning of lymphatic system, which normally move this extra fluid and protein back into the blood. So if the system is not working, then the fluid can build up and it can cause swelling. Now, kidneys also play a crucial role in regulating the body fluid balance because they help in removing extra fluid and they help in excreting this extra fluid in the form of urine. So if the kidneys are not functioning properly, there is a high chance that is going to be development of edema over the feet as well as the rest of the body. So this is often seen in chronic kidney disease, in acute kidney injury, and in nephrotic syndrome. And it, in fact, one of the most common symptom of CKD. So how to diagnose and approach the patient of edema? First, we need to take a detailed history as well as clinical examination. We have to identify the causes of edema like underlying heart failure or kidney involvement or liver failure. So it can be either a generalized edema or it can be a localized edema. Generalized edema means the edema is going to affect all across the body. It is symmetrical and is seen in systemic condition like heart failure or kidney failure. Localized edema means the edema is localized to a particular limb or say one particular leg or one particular arm only. This is because of local causes like any trauma which leads to blockade of lymphatic tissue, any issue with blood flow like DVT or arterial blockade or inflammation. So once we do physical examination, we look for whether the edema is pitting or not. Pitting edema means there is indentation after pressure with finger. It indicates a systemic cause like heart failure or nephrotic syndrome. Non-pitting edema means there is either a lymphatic obstruction or there is because of hypothyroidism. In the case of renal disease, we have to do certain lab tests which will help in confirming our diagnosis of kidney as the major cause of edema. For this, we do CBC, we do renal function test, we estimate serum creatinine, we do urine for protein and microalbuminuria, or we can do a 24-hour urine protein estimation. Then we go for ultrasound of the abdomen and pelvis and kidneys. So a thorough history and physical examination are the key, and we have to identify systemic cause and certain signs will help in guiding the management plan also. Once we come to management of edema, the approach will depend on whether it is a local cause or it is a systemic cause. For local causes, we have to look for non-pharmacological treatment. For example, we need to do certain type of shunts or surgeries. For systemic cause, we need general measures as well as various drugs which are used to reduce the edema. For local edema, the non-pharmacological measures include, for example, limb elevation. If we elevate the limb, there is going to be some respite from edema. It will reduce the swelling. And then we can use compression therapy. For example, in DVT, once there is venous blockade, we can advise the patient to wear compression stocking, which help in improving the blood flow and reduce edema. Then we can go for physiotherapy in the form of massage and other physical therapy, which should be done by trained physiotherapists. Ice application also in cases of inflammation like cellulitis, when there is severe or congested edema, this ice application can help in reducing the edema. Now, if systemic factors are at play, such as in CKD or heart failure, then the treatment will focus on how to reduce this accumulation of fluid and also remove the fluid which is already present. So we have to focus on salt restriction, because once the patient restricts salt, there is automatically going to be less fluid buildup and the volume overload can be managed. Then we have drugs like diuretics, which increase the urine flow and help in removing the fluid level. So there are different types of diuretics. The most common and the most potent are loop diuretics, like we use furosemide and torsemide. They are most commonly used because their duration of action is long and their potency is also good. Thiazide diuretics like metalozone is also quite hydrochlorothiazide. They are also commonly used, but they are more beneficial in treatment of blood pressure. Then we have potassium sparing diuretics like spironolactone. These are used one if the patient is prone to development of hypokalemia, because once you use diuretics, there is not only loss of fluid but also loss of electrolytes like sodium and potassium from blood. So addition of a potassium sparing diuretic will help in reducing the risk of development of hypokalemia. The choice as well as dose of diuretic will depend upon clinical factors as well as the patient condition in the form of severity of edema, his hemodynamic status, and kidney function. If there is hypokalemia, we should avoid using very high dose and we should monitor their sodium potassium regularly. If there is hypotension, again, in these conditions, one has to be cautious while using diuretics. You have to regularly monitor the patient's weight, his blood pressure, urine output, and the fluid status, and periodic tests are also essential. In CKD management, for edema, we need not only salt restriction but also fluid restriction. We need high dose diuretics, especially loop diuretics are quite useful in CKD patients because their potency is quite high. And even in advanced kidney disease, these diuretics are helpful in reducing the edema. On the other hand, drugs like thiazide diuretics, they're only effective once the GFR is good. And if the GFR goes below, say, 40 ml per minute, then these are less likely to produce effect of reducing fluid. So management of edema involves a tailored approach. For local causes, we go for non-pharmacological methods, and for systemic cause, we need to not only go for dietary adjustment, we need diuretics and close monitoring. So in some cases, we even see that very refractory cases, we need to do a dialysis for removal of this excess fluid. So patient education is quite crucial. Understanding the condition, following the treatment plan, and making lifestyle changes can improve the outcomes. Early recognition and effective symptom management also helps in preventing complication. So that's all in the presentation today. Thank you.